Hi, everyone. Welcome to episode 31 of the How to Become a Doctor video podcast. My name is Matt Duras, one of the pre-health advisors, and we'll have our director, Mr. Bowen, introduce himself.
Yeah, I'm Robbie Bowen. I'm the director of pre-health programs for the College of Science here at LSU.
This podcast, video podcast is put on by LSU Phase. That's just our acronym we use: pre-health advising, support, and education. And it's our 31st episode, so definitely check out the other episodes. But they are standalone as well. So if you're just watching this one, that's okay. And we oftentimes have special guests because we've talked a lot, and we like to hear from others as well. And we do have a special guest who, in one sense, is right down the road from us, but in another sense is across the world from us. So you're going to hear about that a little bit. So just want to, pass it off to you, Sue. Why don't you share just a little bit about yourself and your role and your school you're representing?
Thank you, Matt. Hello, everyone. It's very nice to meet you virtually. And my name is Sue Barros. I am the Director of Enrollment for the University of Queensland Ochsner Medical School, located in both Brisbane, Australia, and New Orleans, Louisiana.
That's right. So, both sides of the globe, and we were just talking about that before we started the recording of the opposite seasons at the same time. It's springtime here and fall for them. I'm going to ask you some questions. I know it's going to be a double answer with some of the when we say campus, what's the campus like? You'll have two. So why don't you just start off just with explaining, okay, you guys are a medical school, for your medical school, great match rate, great success. But how does y'all's 4 year look very different than other schools?
Yeah, this is an innovative program. I love that Ochsner is so innovative in how they've designed this program. They've formulated a partnership between the University of Queensland in Brisbane, Australia, and Ochsner Health here in New Orleans. So our students spend the first 2 years in Australia mixed in with all the domestic Australians that's going to medical school. Our cohort is about 90 to 100 students, which we contribute to that class. And then after the second year, for years 3 and 4, our students, our cohort, comes to New Orleans, Louisiana to rotate through Ochsner facilities.
Right. Yeah. It's a very unique, we have something a little bit similar to the LSU system. It's not as far apart. You could do, LSU New Orleans could do year 1 and 2 in New Orleans, year 3 and 4 in Baton Rouge, but not quite as cross cultural as you guys. So that's very unique. So let's kind of start with, we're gonna get into admissions questions later, but just the practicality. Well, just tell us a little bit more about, UQ. Someone may have never even heard of that before. So where exactly in Australia is it? What's that campus like, the campus culture, that sort of thing?
Sure. Well, UQ is in Brisbane, Australia. Brisbane is on the west coast of Australia. It's about 100 miles or so south of the Great Barrier Reef. It's absolutely beautiful country. And one of the reasons we partnered with the University of Queensland is because if you go to US News and World Reports and look up global university rankings, they're about number 36 in the world. Pretty much a big powerhouse entity. They're very much into research, as are we, another good bonding topic. And they have actually invented the Gardasil vaccine. So they're really a strong powerhouse. Our students spend the first year on the St. Lucia campus, and then their second year on the Hurston campus. A little bit different about the curriculum in Australia is in year 1, you actually get to spend 1 day a week in clinic, learning clinical skills. And in the second year, you get to spend 2 days a week with an observership, which transfers into history and physics. So very different than the United States, and it's a great partnership for us.
It's yeah, so obviously, like you mentioned a little bit about those campuses. I just want to pause. So you said that there's 2 different campuses over there. So I want you to explain a little bit about maybe where they are or how they're different for year 1 and 2.
They're pretty much in the city, but on a little bit opposite ends of Brisbane. So the St. Lucia campus has the regular classrooms where our students will be when they're in class. And there's also, at the second year, you're more so in clinic than you are in the first year. So you're closer to the Hurston campus, which is closer to our clinics. and you will have an assignment to some of these clinics where you will be rotating through to learn these different skills.
Okay. Yeah, that's helpful, you sharing that, and getting those different experiences, and like you mentioned, getting the clinical early is definitely something some of our students really appreciate, instead of just being thrown into the fire for year 3. But obviously, we'll get back a little bit. We'll get back to the UQ campus. So year 3, they're in Ochsner, they're doing their clinical rotations. So why don't you share a little bit, about what that's like campus wise, schedule wise, curriculum wise for the second half.
Now, when you come to New Orleans, we're going to ask that you have a car. You don't need it in Brisbane because of the public transportation is amazing. But in New Orleans, you're going to find an apartment, have a car, and there's different clinical immersions. There's the 6-week blocks and the 9-week blocks. And depending on where you're going to go for those might mean that you need your car. So for example, if different clinical immersions like OB or primary care could be in different locations throughout, because Ochsner actually has a footprint from South Carolina throughout the South all the way to Texas. And some of those locations will have these clinical immersions for our students. Right now, we're developing one in Bay St. Louis, Mississippi. There's also going to be in Lafayette, Louisiana, as well as North Shore here in New Orleans, greater New Orleans area. So there could be a variety of places where our students will rotate for their clinical immersions. What's really great about that is because the populations that you're treating here in the city of New Orleans are very different than what might be on the North Shore or Bay St. Louis, Mississippi. So you do get to see a wide range of different populations and different access to care for them and different medical issues that we deal with in the city and in our suburbs and in other locations. So it's really enriching to learn these different kinds of populations that we treat.
Great. And Robbie, feel free to chime in a little bit.
Yeah, we may be getting into this a little bit later, but one of the questions that we tend to get from students when we talk about programs like at UQ is, in terms of licensing, what terminal degree am I going to receive, and how, is that going to impact me when I want to begin practicing in the United States? Can you just talk a little bit about, how that is coordinated with UQ and Ochsner?
Yes, definitely. So it's a good question, Robbie, because it's a very important question, actually, because our students receive their degree from the University of Queensland. It's an MD degree, but they hold a degree from an international medical school. So anyone entering the match may know that the stats for entering a match and obtaining a residency position with an international degree isn't very good. You go to the matching website, the residency match website, you can see that it's about 58% average of matching into a residency if you hold an international diploma. And that's what our students are doing. So that's what I'm asking students to come to our school and enter the match. But I can tell you that we are the outlier. If you're thinking about that bell curve with the 58% at the top, our match rate is all the way into the 90th percentile and has been since our school started in 2009, was our first class. And all graduating classes since then have matched in the 90th percentile. So it's really excellent, I think, because of Ochsner is so well known. They're over 80 years old. So over 8 decades, Ochsner has been a teaching hospital, a strong institution in the city of New Orleans, which has expanded throughout the Gulf South and has a phenomenal reputation and phenomenal teaching experience for our students, where they come out of medical school very well prepared, very well trained, and standing in a great position to enter the match, because residency programs know Ochsner for decades and know the quality of student that they produce. So although you are holding a degree from an international medical school, I think you can stand very secure in the long history of our match rate.
So they would take the same licensing exam as students in a U.S. medical school. They step 1 after year 2 and the same sort of process.
Yes, definitely. Our program is geared for a U.S. residency. It's not geared to stay in Australia, although that is an option. But if you complete, anyone that's a physician in the United States completes a U.S. residency. So it's all built into our curriculum. There's very much support in passing the STEP exam. There's a dedicated course, a lot of online material and protocol of how to receive a great first-time pass rate. So it is geared towards that and to completing a U.S. residency.
And I do appreciate you guys do, put that on the website to just show, I'm just going to show the students here that, you guys have, exactly, match rate per year, having that history, and then exactly where everyone matched. That's really nice. They could see, okay, if I'm interested in a certain specialty, where they matched before. So it's nice that you guys provide that.
Thank you for sharing that, Matt.
For sure. We love just showing the resources for them so they can see on their own. But so okay, so you might have a student convinced that okay, they're definitely interested in the school here. I always tell students, hey, if you didn't have a chance to study abroad, really tough to do as a pre-med, it's kind of a way to do it med school wise without jeopardizing your, having to take a year or two off. But so so someone's like say, hey, I'm interested in UQ-Ochsner and but just kind of want to kind of start with some baselines, how and when would they apply to your program?
Okay, so we have a rolling admissions, and we always have 2 application periods open at the same time. And our class starts in the end of January, beginning of February. So right now we're accepting applications to start in January 2026 and January 2027. And then we interview and we keep interviewing until we fill the class. So as soon as we learn we're going to fill the class, the cohort of 90 to 100, we close that year application. So this year probably will be in the fall, any time between August, September. We'll fill the class, close that application, and then open January 2028.
Okay.
It is a free online application as well.
Great. So, and again, glad you clarified that, it's not through AMCAS, but they can, it's free though, free straight through you guys. You have that timeline, which is a little bit different. But like you said, it gives that flexibility of being able to apply that year in advance. So what are the requirements for a student to be eligible to apply?
The requirements are very basic. We do require that you are a U.S. citizen or U.S. permanent resident. And then admissions criteria, and I'll give you the percentage of how this is ranked. 25% of the ranking is based on the GPA. So we're looking for an A or B average. So between a 3.0 and 4.0 meets that criteria. Then the MCAT, 25% is based on MCAT score. We're looking for a 504 or higher. And then 50% is based on the interview. It's a multiple mini interview, which tests our applicants on certain personality domains, such as kindness and compassion. So that's it. It's very basic, very simple.
Is the interview like a virtual interview, or is it at a location? Or?
It's definitely virtual. It's definitely just like this. As Matt's shared his screen, our interviewer will share their screen. It's scenario-based, where our students read a scenario in which they're involved, and then the interviewer asks them to respond to a question or two.
So, okay, so obviously, like you explained, simple application, you share that, and so, a student might, say, hey, look, I'm eligible for the school, I'm interested in this, but then they might have some hesitancy of this moving abroad, even though it's exciting, definitely a far way away, that sort of thing. So, what sort of things is your program doing to help prepare and come alongside students with this transition of experiencing another culture?
Well, definitely good question, because, we realize that our students just aren't overseas. They're overseas in the Southern Hemisphere. It makes it very long plane ride to get there. It's not easy to get home. You can't fly home on a weekend for a hug from mom or your family. It's just really hard. So our students, they really learn resiliency and independence and how to collaborate. The support is amazing. There is your regular well-being support, of course, like in student health. But then there's a lot of support, well-being support that's supplied for our students. There are society heads, which are teaching faculty physicians with a special interest in mentoring students. And there are 5 faculty heads. We divide our class into 5, and each student belongs to one of these societies. The society head mentors these students through all 4 years. In the year 1, they fly to Australia to meet their cohort and meet their society group and have one-on-one visits with them. So that's their main support. But there's also the personal advisor network. There's a lot of peer support in that second year students will tutor our first year students. It's very collaborative. It's not competitive at all. Everything is geared towards each student's success. I can even see on Facebook how they set up their tutoring sessions. They talk about the pitfalls if they're going to a next step, how they should be careful to avoid these situations, make sure this is in on time, remind them of deadlines, have get-togethers of tutoring. So very much collaborative. Everyone is taking care of everyone else to get along. So it is far away. I do find that students say they come back changed. I can think that if you go through medical school, right, you're going to be changed anyway, but in different kinds of ways. Like someone said they thought it was far away and not too prepared to go, but since they went through and did it, she said she's a whole new person. Like has no fear, built her confidence, and she's truly changed.
So, like, what would you say are some differences about the medical system in Australia versus the US? What are some things that maybe you've noticed or the students notice, from their perspective?
Well, Matt, it's socialized medicine there, where everyone has medicine. It could be different levels. You could buy into different levels, but everyone has access to care. So one thing our leaders of the schools thought about was that when our students are there, they're not only providing care, they're also receiving care themselves. So they get to learn about socialized medicine and how medicine is in different parts of the world. And of course, they're back here in the States, and we all know what our medical system is like. But they get to learn like how it's advocated for, how it is the business of medicine, and they're poised to become world leaders in medicine because they have the global perspective and understanding of medicine on the world stage. There's good and bad in both systems and all systems, but they're the ones that's poised to know and see and discern the differences of making change for the better in the field of medicine.
So, just going back to the application for a second, like what are the parts of the application? Do you have to send transcripts? Do you have letters of recommendation? What all does the application encompass?
Thanks. I'm glad you're bringing that up, Robbie, because it is very simple. You just have to upload your unofficial transcript, but you also have to follow that up with an official because they cannot complete the review until they receive the official transcript. You can apply without having the MCAT, but you have to upload something in the MCAT field. So it could be your verification number if you have it scheduled already. If you don't have it scheduled, you can upload a document stating that you will provide that information once you receive it. And then what is not part of the application? Well, no cost, of course, and then no letters of recommendation, no personal statement or essay, no resume or any experience at all. That's completely not part of the application. It kind of levels the playing field because everyone comes with 2 boxes checked off, A or B average, 504 or higher at MCAT. And the 50% of the decision of the multiple mini interview is us finding out who our applicants are directly from themselves. Very holistic approach.
So just to clarify, like so obviously this, if a student wanted to submit a letter of rec and they were pushing, it's not going to be considered, right? It's just those things that are considered.
It's correct. It's completely not part of the application. There's
Right.
nothing to bias this interview at all.
Right.
It's level playing field for everyone.
Right. Okay, so just wanted to kind of hear, as your students have graduated, gotten a residency, now you guys have students that are practicing in the field. What are kind of some things you've heard the graduates say that it's very UQ-Ochsner, like they're so glad they did it. Like you talk about the global health, but what's maybe just some other unique aspects of the school that they really appreciated or really enjoyed?
Yeah, certainly some of the things I did mention, like the resiliency and building of character and independence, the understanding of medicine in different parts of the world, and that connection to that. It's really life-changing to go to Australia, spend 2 years there, and then come back to the States. We've graduated our 1,000th alumnus or graduate this past November, and it's great to hear how many of our alum are out in the world practicing medicine, and then they come back to us, like oftentimes chief residents. So it's wonderful to have someone that's an international medical graduate acting as a chief resident. So they really are blossoming they're throughout all 50 states. We have alumni and spread all of it. It's not that we collect just from the Gulf South. It's truly a United States wide where we have alumni throughout. And they are very excited about this program. And word of mouth from alumni and current students, someone that knows the program, is almost the top #1 reason why we get applicants, because they speak so well of this program.
So it seems like, maybe a student, seems like it's very possible to do residency in Louisiana. If there's a student that wants to stick around for residency, is that maybe a common thing a student can do for that?
Yeah, definitely. We always ask, we know the caliber we train the students to. So we always want them to apply for a residency here with us. And oftentimes they do, but mostly everyone kind of wants to go back home. So that's quite common. But we also have a scholarship. It's called the Physician Scholars Program, where in certain fields, medical fields, Ochsner will pay 3rd and 4th year tuition if our student agrees to work for them for 5 years after their residency is over. You'll see that on our scholarship tab too. And I think that's amazing for someone from the Gulf South or from Louisiana area to take advantage of that. It's an amazing opportunity.
When would they have to commit to that by? Like when do you apply for that third,
3rd
fourth year?
or 4th year.
Okay.
They might not know or make up their mind till 4th year, but it could be in 2nd year that they know they want to stay in Louisiana and practice here.
Okay, great. Yes, they don't have to, start first year already committing to that. They can, start med school, do year 1 and 2, and then commit. So that's nice to know for them. We're obviously here at LSU students, many from New Orleans. That's our #1 feeder city, for our students. And, but a lot of them like to kind of experience in a different part of the world, but then come back home. And so this is a unique way for them to do that, and for you guys to, allow them to experience a different place while it not pausing their journey to residency.
Yes.
So while they're in Australia, is there housing that's available? Do they find apartments? How does that work?
Yeah, there is housing, there are campus housing, but I found that the students say that our med students don't want to stay there because undergraduates are
Right.
there. So what they do is network, and they use Facebook a lot for their networking. And each class has its Facebook page. So if you look online and find something that you think you'd want to stay at, you can ask online, ask our Facebook 2nd year students that run the Facebook page, like where is this place? Where's the location to campus? Do you recommend this neighborhood? And they're really great about even checking it out for them and letting them know this information, if it's a good price, a good location. Um, I think that it's sort of like New Orleans, where we have neighborhoods that kind of fit your personality. So there's the swanky South Bank, where South Brisbane, where there's the lots of restaurants and things to do and nightlife. Then there's the West End neighborhood, which is more like libraries and parks, maybe homes. It's better for families, but they take advantage of all of these different types of locations and seem to be able to network really well with our current students that's there on finding the type of place that fits them.
Yeah. So, if somebody is, really interested in your program in UQ, like what would be your advice to them? How can they stand out in that application process, or what types of skill sets do they need to be successful in the application process?
Well, listening to our leaders like Dr. Iran Amadi, he always says he's looking for someone with a passion for studying medicine, the passion in working with the field. And this truly comes out in the multiple mini interview, because you can really tell the how much the depth of caring that our applicants have for pursuing this career. So it really happens there when you can shine and show your passion. But also, I would suggest looking at as much social media as you can to learn more about our program, hear from our students directly. There's on our website, there's under the admissions tab, there's one-on-one support where anyone could go and schedule themselves an appointment with a current student, me as well, but have a one-on-one chat like this with a current student. And there's even the student bios that are there, so they could read about someone that's maybe more like themselves that they could identify with and get their perspective. So I'd recommend that greatly.
So I'm glad you mentioned, your website and such. And so, we're just kind of finish up here. We didn't cover everything. There's a lot more for students to know. So what is the best way if a student wants to find out more about UQ-Ochsner? What's a few different resources that they could check out?
Well, certainly pour through the website. The different tabs there can bring you to several different areas that are important. We post a lot on social media, so YouTube, Instagram. We have a webinar once a month with Q&A in it, so anyone that joins can ask any questions they want. I'm very accessible, so you can always just email me or just look online. Anything, I'm happy to, the one-on-one chats can be with me as well. I always share a number you can text with me, and it's very accessible. So reach out to me or look online, and anyone's probably willing to help. Our students very much enjoy chatting with prospective students.
Thank you. Well, look, thanks for joining us again. Like we said, it's just a short moment for them to hear about your school, but we're looking forward to our students to finding out more. But appreciate it, and we hope to send some students your way.
Thank you so much.
Thank you, Sue.